Hello and a warm welcome to the weekend edition of the Tamil Nadu Brief. I'm Sam Daniel. Well-known liver transplant surgeon Dr. Mohamed Rela has become the first in the world to perform a robotic liver transplant surgery on a 5-year-old child. Joining us now, Professor himself. Doctor, thank you very much for your time. Congratulations.
Thank you very much.
How special is this? Tell us about the patient and his condition that required a robotic surgery.
First of all, I think this is very special and it is a milestone in the field of surgery. Now, robotic surgery itself is probably a new surgery, new kind of surgery. Probably has become popular in the last 5 years, I think. And robotic surgery is where you have a pinhole like the laparoscopic surgery. It's a keyhole surgery. But the maneuverability is much better than laparoscopic surgery. The surgeon sits away from the patient in a console and he controls the arms of the robot, and the arms just go through a small incision, and then you can do actually very delicate complex surgery using the robot. So this is the principle of robotic surgery. Now, robotic surgery has been used in urology, in prostate surgery, that's commonly used, in oncological surgery, in gynae surgery, and even cardiovascular surgery, robotic surgery has been done. And the huge advantage of robotic surgery is that the more complex the minimally invasive surgery gets, it's more useful in those situations. Now, we started doing robotic surgery in liver surgery, in liver resection, where we can remove half of a liver due to cancer, and also in pancreatic surgery, in Whipple surgery. And we also did it for really living donors. We also did it for living donors. Living donors is they give half a liver to their relatives. Usually parents give about 25% of the liver to their children. And the more importantly, young adults, say 20-year-old, 22-year-old, college-going boys and girls, giving part of their liver to their parents, they'll end up with a big scar in the abdomen. And to have a big scar in the abdomen is a huge problem for young ladies, particularly when they are unmarried, because later on when they want to get married, it does become an issue that they've got a big scar in the abdomen. So we really did this for donor operation and to help young people not to have a scar. So this is how it started. Now, natural progression of liver surgery being done robotically is to do the most complex of all procedures robotically. So we did the donor operation robotically, and next we went into doing recipient operations robotically. If you look around the world, there is only one center in Saudi Arabia where there is a German surgeon who's been pioneering doing recipient operation robotically, and we at the same time have also been doing the liver transplant recipient operation robotically, and we have done about 10 of these cases, some of them partially and some of them completely. Now, what is special about this case is, this is the first time a liver transplant operation in a child, which is a recipient operation, has been done robotically. Now, why is it special in a child? See, adults have a big abdomen and the robot arms are quite long. And once you distend the abdomen, there is room for maneuverability. You can move the instrument around. Children have small abdomen, so the maneuverability of the instrument is much less in children. So it becomes more complicated. The second thing is, when you operate on these small children, liver transplant involves connecting blood vessels. And adult blood vessels are larger and are easy to connect. In children, the blood vessels are smaller and they are more difficult to connect. But the advantage of robotic platform is it's got magnification which is 10 times. When you look inside the console and you're controlling the arms of the robot, it's 10 times magnified. So in fact, you could do it more accurately in a robot than even in an open operation. So this operation was tried in a child from Haryana. It's a child who is about 4 years old, and the child has a condition called urea cycle defect, and these children have high ammonia levels and can get into coma repeatedly. The family already lost a child due to this condition. soon after birth they lost a child. So when this child was born, they had made a diagnosis that this child has got urea cycle defect because they had previous experience of a child dying. And then it's very restricted diet. They can hardly give any protein in their diet. No dal, no eggs, no meat, nothing. So it's a very restricted diet, and that's very tough for the family to bring up a child, because if the protein intake goes up, the child will get into coma, and most of them don't survive to really their teenage also. And liver transplantation is a cure for this condition, we know, and we have done many liver transplants as an open operation for urea cycle defect. But the advantage of this child for robotic, why we chose this child, was the child doesn't have cirrhosis, the child doesn't have portal hypertension. So technically it is feasible to do it robotically, a little bit easier than in a very sick child it's technically easier to do it than in a very sick child who's a cirrhotic with portal hypertension. So that is why we tried this, and fortunately we were able to complete the operation totally robotically. Right. And this makes this child very special, that this is the first child to have liver transplant done through the robotic platform completely.
Doctor, give us a sense of benefits versus risks.
Okay. Now, let's talk about the risks. Any liver transplant operation, they carry risk. The main problem with risk is bleeding in liver transplant operation. Now, when you do an open operation and when there is bleeding, you can deal with it very quickly and easily. So, whereas in a robotic, to convert a patient who's bleeding from a robotic to open, it takes time to open. So, potentially it could be dangerous if there is a major bleeding. So, this is about being experienced in the surgery and doing it in a very controlled manner, that you never lose control that there is a bleeding. And also you have to put strategies to be able to open the abdomen quickly if there is ongoing bleeding for these children. So that is the major risk that people will fear offering this operation as a new operation for somebody. Now, what are the benefits? The benefits were very clear for this child as well. We have seen the benefit in this child. Normally, when you do an open liver transplant in a child, the child is in hospital for about 2 weeks at least, sometimes up to 3 weeks. But this child was ready to be discharged in 7 days. You're almost saving 1 to 2 weeks of hospital stay. Okay. And the pain is much less for the child. They don't experience much pain because the incision we make is very small and you don't see any scar in the abdomen. And the second advantage that I see as a very important and the most important advantage is not having a scar for a child. When we do open liver transplant operations, there is a very large scar across the abdomen, almost about 9 to 10 inches of scar across the abdomen is what we have to make to do a liver transplant operation in a child, and in the adults it's even bigger. The scar is much bigger to do a liver transplant operation. Now imagine a child having a large scar in the abdomen, and they may not realize it when they are children. When they become teenagers, they do become shy about showing their scar, whether they want to go to the playground, take their t-shirts off, or if they want to go to a swimming pool, they've got a scar, and it's even worse when they are actually wanting a girlfriend. It's actually something which is not quantifiable that easily, that what these children go through when they have a large scar. We do know that the donors who have a scar, particularly young ladies who have a scar, find it difficult to get married, because there are boys who say, oh, I'm not interested because there is a large scar in the abdomen. I mean, we live in that sort of a society, and I'm sure it's the same everywhere else in the world. So I believe that not having a scar for these children will help them develop in a normal psychosocial manner, rather than always be worried that they have a scar and they can't expose their abdomen.
Anything you can share on the cost and longevity of such patients who undergo liver transplant?
The first thing about cost, the robotic surgery has additional costs because the instruments are very expensive that we use, and each instrument can only be used about 10-15 times. And so the additional cost for robotic surgery may be up to 2 lakhs, 2.5 lakhs. But if you see the number of days that they stay in hospital, if they can be discharged 1 week before, that is actually balanced by the early discharge. So technically there may not be an additional cost for this procedure. Longevity, the longevity of these children after transplant is exactly the same as an open operation. So if they don't have complications, children who have liver transplant for various conditions can live a normal life for 20 years, 30 years, 40 years, 50 years. There is no problem in terms of longevity for children who have liver transplant. And I hope that doing it robotically will exactly be the same.
Right.
Okay. So I don't think in terms of longevity there is a difference between open operation and a robotic operation. In terms of cost also, it's neutralized by the short stay compared to the additional cost of the instrument itself.
What will be the range?
The range of?
The cost.
The transplant cost for us would be around 20 lakhs to 24 lakhs.
Is it also a concern, doctor, that the prohibitive cost could actually be affordable only for the affluent, not
That
for the
is
common
true.
person?
That is true in our country. 20 lakhs, 24 lakhs is a lot of money and not every family can afford. And this is where the public sector and the government has to come into play. There are many NGOs who might offer money for children, particularly for children. It's not very difficult to get money from NGOs, and there are lots of philanthropic people that I know who are very happy to offer part of the funding for transplantation of children in particular. We find it very difficult to go to them for transplantation of adults, whereas children it's easier to do. But in Tamil Nadu, the situation is completely different. In Tamil Nadu, the government itself will fund the transplant.
Okay.
If they are not affording, the government gives about 18 lakhs for the transplant itself, and then gives medication for the next 2 years also, which might amount to another 2 to 4 lakhs. So there is a huge advantage. So in Tamil Nadu, whether you're wealthy or not wealthy, whether you can afford or can't afford, the government will sort out the cost of liver transplantation. In fact, any transplantation.
Irrespective of where it is done.
Irrespective of where it is done. It doesn't have to be done in a government hospital. They will also fund the private hospitals to do transplant under the CM scheme.
Doctor, just a pedestrian question to help a common person understand. Does a robotics transplant mean that doctors sit at a remote place, program something and let the machine do everything?
No. It has to be real time. You can't program and then let the machine do whatever it wants. You can't put in there, do a liver transplant, and then a machine goes in and then does a liver transplant, or say do a hernia repair on the right hand side of the groin and then it goes and does a hernia. No. In fact, the machine's hands are operated by the surgeon's hands. The surgeon technically sits in the same room in a corner. This is the current situation. We'll talk about the future of robotic surgery. The surgeon sits in a corner in front of a magnifying glass in a console, and he's got like a clutch, like driving a vehicle, and he's got the arms, 2 arms. In fact, the robot has 3 arms and a camera port. So there are four ports, 4 holes in which it works. And the surgeon can operate 2 arms at a time. He can hold something and then change the clutch and use the other arm. So even an assistant job is done by the robot. So every fine movement is the hand movement of the surgeon. So it just replicates the hand movement of the surgeon. So the robot doesn't do things on its own. So that's the first thing. It's not like it doesn't even look like a man. The robot's only got arms. Okay, it doesn't have a face, it doesn't have a leg, it doesn't have anything. It's got a pedestal and it's got 4 arms. So that's where it's different. Now you ask me, the advance for the future is, now supposing in one country there is no facility to do liver transplant. And can I do the operation sitting in my office with a console in my office And let's say the robot is in GH or in, say, in Stanley or in any other hospital. Can I do it? It's been done. It's been done for very simple operations like a hernia repair or an appendicectomy. The problem for that is, even today, even in your television, when you're interviewing me, when it comes into the television, there is a lag of 1 or 2 seconds. Yeah? So we can't have that lag in complex operation.
Right.
If something starts bleeding, I can't stop it after 3 seconds. So until we get real time technology where what I operate now, because inside the same theater it's real time, it's hardwired between the surgeon and the robot, it's hardwired. Whereas once it goes to surgeons sitting in one country, technically this can happen. Surgeon can sit in India and operate on a patient in the United States or in the UK, because now Indian surgeons are really on top of the field compared to the Western countries. So I could be sitting in my operating theater and operate on a patient in the UK, provided the speed of such transmission is so rapid that it is real time. And maybe it will come one day.
When do you think?
Where operations, I don't know, you tell me when technology is going to improve to the level when it's going to be real time. You haven't brought it on television yet so far, have you? It's not real time. There is a delay of about 2 seconds.
2 seconds, that's right, yes.
Even that needs to be reduced to milliseconds for it to be done.
Doctor, we live in this artificial intelligence era. Give us a sense of the kind of changes bound to happen in the medical field in the years to come.
Artificial intelligence is going to be medicine is going to be influenced hugely by artificial intelligence. What humans have to learn over many, many years of experience, artificial intelligence will learn in no time. So, particularly it's coming in radiology and pathology. Okay, a pathologist who is looking at a slide with cancer cells have to look at, say, 100 of those cases to confidently make a diagnosis. Artificial intelligence can learn 1,000 times more than what he can learn within a week and make a diagnosis. So humans may just have to cross-verify. In the future, artificial intelligence will be better than humans because they can learn much, much faster. So wherever the human intelligence is not immediately required, artificial intelligence in diagnostic fields, for example, you have a medical history running for about 10 years, and then I have to listen to that and make a diagnosis. I can miss 1 or 2 facts about what drugs you're taking, what are the side effects, but artificial intelligence can take everything into account in no second. Do you understand? So medicine is going to be hugely influenced. Now artificial intelligence is going to be introduced even into the robotic surgery. One of the main disadvantages of robotic surgery is sometimes surgery there is a feel to it. When you're operating, you open the abdomen, you feel the tissue. You feel something which is abnormal, particularly in cancer surgery. In a robotic surgery, there is no feel. You don't know if you're holding something hard, you don't know if you're holding something soft, because the machine is holding. You close your forceps on something, you don't even know if you're holding it hard. So there is no feedback to your brain that something is feeling hard or not. I think artificial intelligence, they say, is going to bring that. They call it haptic feedback. So the haptic feedback will come when you introduce artificial intelligence, and it will tell you that you're holding it hard, you're holding it soft. So I think artificial intelligence is going to have a huge influence in the field of medicine.
Lastly, you have performed hundreds of liver transplants.
Thousands
of liver transplants. Any one case that's always close to your heart?
There are many actually. I think the ones which are always close to our heart is how dramatically children improve. You may have heard I did a transplant on a 5-day-old child, which was the youngest child ever to have a transplant.
In Europe?
And in UK when I was working in King's College Hospital. And that girl is now, I think, 25, 26 years of age, and she's a lawyer. That will always be in my mind. And there are many others really who come in a desperate situation and have a beautiful life. And when they grow up, you don't even recognize them because you see them as a child. And you often recognize these children when they grow up, when you identify the parents, not when you identify the children, because they've completely transformed into beautiful adults. So it's very satisfying to do liver transplants in children. I think pediatric surgery as a field itself is an extremely satisfying field.
Doctor, thank you very much for your time. Such a joy speaking to you.
Thank you very much.
Thank you, Doctor. That's all the time we have for on this weekend edition of the Tamil Nadu Brief. Hope you liked it. That was Dr. Mohamed Rela, who performed the world's first robotic liver transplant on a 5-year-old child. Goodbye.